Support for the Journal of Clinical Oncology podcast is provided in part by AstraZeneca, dedicated to advancing options and providing hope for people living with cancer. More information at AstraZeneca-US.com.
Hello and welcome to JCO Precision Oncology Article Insights. I'm your host Miki Horiguchi, an ASCO Journal's editorial fellow. Today, I'll be providing a summary of the article titled Expanding the Reach of Personalized Medicine in Cancer Care, Current Progress and Future Directions of JCO Precision Oncology. This is an editorial by Dr. Yushu C. and colleagues that investigated trends in publication, peer review, and global influence of JCO Precision Oncology. Before getting into the editorial, I'd like to briefly introduce to Precision Oncology and the JCO Precision Oncology Journal as a leading platform for research in this field. Precision Oncology is a personalized medicine approach that leverages advances in genomics and molecular profiling of tumors, biomarker-driven decisions, and targeted therapies to enhance clinical care for patients with various cancer types. Since there are many aspects to consider, such as biologic, clinical, and statistical aspects, advances in precision oncology also come with numerous challenges. These include identifying targetable mutations and addressing tumor heterogeneity and drug resistance. Other challenges are developing new study designs and statistical analysis methods to evaluate new approaches, as well as developing methods to manage large and complex datasets. Since the American Society of Clinical Oncology introduced the journal JCO Precision Oncology, or JCOPO, in 2016, it has played an important role as a dedicated platform for publishing high-quality research and promoting discussions on those challenges. JCOPO is a peer-reviewed, online-only, article-based journal publishing articles across multiple categories. These include original reports, case reports, review articles, commentaries, correspondence, editorials, special articles, and molecular tumor board case discussions. The journal's contribution to the advancement of the field is reflected in the journal's impact factor, which was 4.6 in 2022 and 5.3 in 2023. In the editorial, Dr. C and colleagues first investigated the publication trends from 2017 to 2022, highlighting cancer types, article types, the number of citations, and topics of papers published in JCOPO that have had broad impact. The papers accepted at JCOPO covered a broad range of research topics, including genomics-driven tumor treatments, molecularly selected targeted therapy, translational oncology, cancer biomarkers, gene expression and profiling, biostatistics and clinical trial methodology, epidemiology, and cancer prevention and control. The most common cancer types are thoracic, GI, and breast cancers. Original reports were more likely to be cited than case reports. The average number of annual citations for original reports was 4.33, while it was 1.39 for case reports. The authors listed the 10 most cited papers published in JCOPO in a table. The most cited paper was an original report titled Landscape of Microsatellite Instability Across 39 Cancer Types by Bonneville and colleagues. The paper has been cited more than 600 times since it was published in 2017. Next, the authors conducted an analysis to see trends in peer review. When manuscripts are submitted to JCO-PO, they go through a rigorous peer review process. Reviewers evaluate them based on 5 key metrics: importance of the study, originality, quality of writing, relevance to clinical practice, and scientific strength. Each metric is rated on a scale from 1 to 5, with higher scores indicating better performance. Dr. C and colleagues compared the rating scores between accepted and rejected manuscripts of original reports and case reports. They found that the median score of accepted manuscripts was above 3.5 for all metrics. The findings highlight that no single metric determines acceptance, underscoring the importance of excelling in all 5 areas when developing manuscripts. Finally, the authors looked at trends in global influence in JCO-PO, counting the country where the corresponding author's institution is located. Dr. C and colleagues found that JCO-PO has accepted manuscripts from 36 countries, indicating a steady increase in its global reach. The United States accounts for about 71% of the total contributors. The other top contributors include France, Canada, Italy, Australia, the Netherlands, Germany, Japan, the United Kingdom, and China. Notably, global collaborations among authors have significantly increased, with the proportion of papers from multiple countries more than doubling from 12.5% in 2016 to 26.5% in 2022. These facts reflect JCO-PO's ongoing commitment to engaging with the international precision oncology community and encouraging global research submissions. At the end of the editorial, the authors provided some guidance for future authors. Across original reports and case reports, successful submissions to JCO-PO typically have a translational focus. They provided a mechanistic understanding of tumor biology and utilized cancer genomics to inform clinical decision-making. The authors also highlighted several underrepresented but growing areas of interest at JCO-PO. These include pediatric oncology, sarcomas, ethics, trial methodology, informatics, computational approaches, and statistical methods related to precision oncology. Furthermore, the increasing significance of germline genetics, pharmacogenetics, molecular diagnostics, and molecular epidemiology in precision oncology has been recognized and valued by JCO-PO. JCO-PO also had special issues. The special series feature timely research topics such as equity in precision medicine, statistical methods for precision oncology, and next-generation sequencing. Through these special series, JCO-PO continues to lead the advancement of the application of precision oncology across a diverse patient population. The authors also provided points to consider when submitting case reports. For successful case report submissions, especially N of 1 reports that showcase novel findings with potential clinical impact, it is crucial to include robust data to support the clinical observations, investigate underlying mechanisms, and ensure proper protection of patients' identity and autonomy. An N of 1 report alone is often insufficient for publication. Successful case reports typically extend beyond a single patient, examining the phenomenon in multiple patients and providing mechanistic validation, either in vitro or through preclinical models. Thank you for listening to JCO Precision Oncology Article Insights, and please tune in for the next topic. Don't forget to give us a rating or review, and be sure to subscribe so you never miss an episode. You can find all ASCO shows at asco.org/podcast.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.